services through the health exchange. The health exchange will be like a marketplace that will be developed by 2014, and anyone who wants to, like if you go to any online, like if you're looking for flights or something like that, you have a location for Travelocity or whatever, and you put in whatever you need, and you get a bunch of things that match your request and your and the money that the flight will cost. The same idea where there will be a web-based application where all health providers that want to be listed on that excuse me, can do so, except to be in that exchange, you have to provide a certain standard of coverage for your patients. Excuse me. Another huge thing that is starting this year also is that there will be your insurance cannot charge you co-pays for any preventative services. So if you are going in for a routine physical or getting a vaccine for your kids or anything that qualifies, anything that qualifies as a preventative service, you do not have to pay a copay for. Another really, and I mentioned this before, the comprehensive essential benefits will be developed by 2014. Another huge thing is the way that physicians get paid will eventually shift over time. Because currently the way it usually works is they get reimbursed by the number of procedures you do and things like that, or the tests you do. Whereas the ultimate goal is to provide physicians with payment for quality of the care that they provide and not the quantity of care that they provide, and that will be through payment incentives and things like that. So another one of the things, and this is highly focused on the insurance market as well, how it will provide better service for you. One is, and this starts this year, is that your insurer will not be able to drop your coverage once you get sick. There is a little caveat in that, and I'm sure you guys have, if you read the papers, you hear of a lot of insurers still doing this, because the caveat that the exception that they use is that the way in which they can deny you is if they say that you were fraudulent in your initial application with your insurance. So that's kind of a loophole that still exists. But in theory, they will not be able to drop you after you get sick for your particular coverage. Another thing that will, starting this year, all kids will not be allowed to be denied coverage due to pre-existing conditions. This does not take effect for adults until 2014, but by then, at that point, adults will not be able to be denied coverage for pre-existing conditions as well. The other thing is that insurers will be required to make their policies more transparent. So that happens by, the contractual language, things like that will have to be simpler. They'll be able to make what they do or how they deny you more transparent. Some portions of that also starts this year. The other thing that also starts this year for regulation of insurance markets is that not that they cannot deny you or that they cannot increase your premiums, but it will be a little bit harder for them to do so, particularly around premiums. They will have to explain why they are doing it. They can't just do it without any sort of explanation. So, and the other thing was, and this talks to the exchange, is that there will be a new website that compares companies and what they offer and how much they offer it for, which will make comparison easier. And that starts to some extent this year, but the exchange will be fully functional and running by 2014. So, all of these changes will ultimately lead to healthier communities. The idea is that by 2014, an additional 30 million people will be within the healthcare system and have access to affordable healthcare. The other thing that helps towards that is that, and this is relevant for many people probably here as well, is that if you have adult children under 26, they will this year be eligible, and this for staying on their parents' coverage until they are 26. And this was supposed to take effect in September, but the vast majority of insurers have agreed to push it up to May when people actually graduate college, because usually right after you graduate, you end up falling off of your parents' insurance. So by June, I believe most of the biggest insurers will allow you to keep your adult children on your health care insurance. The other a number of things that will help build healthier communities. One is there will be a large investment in community health centers. So for people that have to access healthcare in community health settings, which is predominantly accessed by people that are lower income, inner city, rural health, that sort of thing, that don't have access to healthcare all the time, there will be a major investment in those community health centers. And another thing that also happens this year is that there will be a large amount of money available for community assisted living services. So particularly for seniors and or disabled adults, there will be more money available for assisted living centers. So how does this help providers? So I've been talking a lot about the patients and how it will help you, but if you are a provider, you will most certainly be interested in how this will affect you as well. So I will only briefly touch on this, as that is not the main purpose of the presentation, but you can ask me questions to it. One is that it will increase the number of primary care providers, practitioners, particularly primary care physicians, but also nurses and other healthcare practitioners that deal with primary care. Starting this year, there will be a major investment in primary care education. There will be an increase in reimbursements for primary care providers as well, which takes me to the next point. There will be increased payments for mental health, primary care, and rural health. Above and beyond, and anybody who works in shortage areas, so whether it's the inner city or rural settings, your reimbursement for the services you provide will be greater than if you did not work in those settings. The other thing that it does is that for a provider, if anybody's ever filled out an insurance claim, things like that, it can be quite cumbersome. Starting 2013, there will be standardized insurance forms to fill out for providers, so they don't have to go through 15, 20 different types of insurance provider information and contracts and that sort of thing. And another thing which has already started, particularly with last year's stimulus package, was a major investment in health information technology, having electronic medical records, that sort of thing, already started, and that will continue. So, and reimbursement at some point will be higher for people that employ that sort of technology in their practices. So, last thing, of course, it talks about is costs. So, according to the non-partisan Congressional Budget Office, they say that it will reduce the deficit over 10 years. And that Medicaid will be fully financially stable. The other thing that starts this year that is related to costs is that there will be subsidies available for small businesses if they provide health insurance for their employees. Because right now it becomes prohibitively expensive for small business to provide that service for their employees. And there will be a large investment in to help reduce Medicaid fraud and abuse. So that will also help control costs. So I'm going to go through some common questions, and then we can take some additional questions for anyone who has them. One obviously comes up is, will my insurance change? Not really.